Back this morning with Dr. Fahd Rawra from Samaritan Medical Center, and we're talking about obsessive compulsive disorder and just how common it is. Good morning.
Hi, good morning.
And is that true? It's more common than what maybe we think?
It's about 2.2 million people in the U.S. suffer from it. It is a type of an anxiety disorder.
What does it mean?
So obsessions and compulsions. Now, all of us, at times, we will check things. Like we'll check the stove, make sure it's off. We'll check the locks, make sure they're locked. People have this anxiety, constant worrying about certain things, and they can't shake it off. They can't turn it off. So, for example, people will be worried about intruders coming into their house, and they'll just consistently worry or constantly worry about it. They can't take it out.
It takes over their life.
Takes over their life. And so that's what we refer to as an obsession. Now, in order to overcome or forego this anxiety, they come up with certain rituals that they'll do that helps very temporarily, and at times doesn't at all. So somebody who has an obsession over, intruders, they'll repeatedly check their locks over and over and over.
Maybe a little more than average person would.
Oh, absolutely, absolutely. It actually, definition-wise, it's supposed to take up more than 1 hour of your time, either thinking about obsessing over this or the compulsions.
Do people realize that they have this?
Yes, so that's what's a little different as compared to some of the other illnesses that we've talked about. This is something people definitely realize and they don't like the way they're feeling.
Right.
So a lot of times they'll go out and try to self-medicate with drugs, with alcohol. I want to give you a very quick example. This is a very well-known example to us in the psych community. There's a famous case, if you would, a female who had to get to work by 8 in the morning, and she leaves her house at 6:30. She has to take a bus to get to work, and the bus stop was about half a mile from her house. And she had this obsessive thoughts about, did she lock her door or not? And this compulsive behavior that followed it. Let me go check my locks again. So every time she would get to the bus stop a half a mile away from her house, she actually had to, she couldn't help it, she had to actually go back. So by the time she actually realized what was going on, or realized it was 1 o'clock in the afternoon.
Wow.
So she left at 6:30.
Goodness.
I mean, this is an example that we use kind of just to make people understand.
So is there treatment then? Is there a treatment?
Yes, there is treatment. We do therapy along with medications. Therapy does have a very strong role with this illness.
And what's the success rate?
Variable, but it does end up helping. For the most part, we're able to at least help control a lot of these symptoms.
And obviously a better choice than self-medicating.
Absolutely, drugs and alcohol.
Right, not
Thank
the
you very
answer.
much. Thanks for coming in.
Thank you.
We appreciate it. Okay, we're back here in a couple of moments.